While many know the emotional, mental, and physical toll cancer can have on the person with the diagnosis, navigating a complicated care plan can be daunting for many families and caregivers. Audrey Haberman, the CEO of the Sherry and Les Biller Family Foundation, joins me along with Charlie Garcia, a small cell lung cancer survivor, to tell us about the supportive care that connects people living with cancer and caregivers to real life support. Thank you both so much for joining us. And Audrey, let's start with you. What are the biggest challenges in navigating the cancer care system?
Thank you for having us. One of the things that many people with cancer report is that it takes a lot to just handle the treatment for their cancer, but of course the rest of their lives are also impacted by it. And as you said in your introduction, there are many other issues that people are facing besides just the physical treatment of their cancer. It includes their emotional stress or the impact of it on themselves or their families, the challenge of juggling work sometimes, making it to appointments, getting support for pain or nausea, other impacts of the treatment, getting help with the financial burden or the insurance. So all of those things we talk about as supportive care, and it's a wraparound way of treating not just the cancer, but the person as well.
So what is supportive cancer care then, and what exactly are the benefits?
Supportive cancer care is also called whole person support. And the benefits have been shown through research and evidence that when people get this kind of wraparound support, their outcomes are better and their quality of life is better. So when many providers forget to offer, or many people don't feel comfortable asking for the kinds of things that are going to help them have better outcomes. And those are things like emotional support, help getting to appointments, managing the financial burden, some of the impacts of the treatment, such as getting help with pain management or nutrition. All of those things make someone's experience much better.
Well, Charlie, can you share a little bit about your story as a cancer survivor and how this care has supported your journey?
Definitely. I was diagnosed with small cell lung cancer the week before I turned 40. It was pretty drastic, and I don't think I'd be around if it weren't for the supportive cancer care that I received. I had the most amazing caregiving team, and they helped carry the burden of really, really rough battle that made me get on the other side and survive. So I'm definitely grateful to them for it.
Wow, I'm so glad that you're doing well, and I'm so glad that they were able to help. What advice do you have then for people and families maybe facing a diagnosis?
I definitely would suggest that you ask for help and you ask your care provider for the different options that you have available to use your resources. Definitely visit our website, supportiscare.org, and find out there the different aspects of cancer care that you don't really think about. You think about chemo and radiation, but there's so much more that needs to happen in order for you to make it. People need to help take care of you. You need to be able to get proper nutrition and definitely mental health. So I think my biggest recommendation would be to look for help with a therapist.
Can you give us that website one more time then where we can learn more information?
The website is supportiscare.org, and there is information there for both people with cancer and caregivers about what supportive care is and how to ask for it, as well as the work that we're doing to try and make this kind of care the national standard of care so that people will just get it as part of their treatment and they won't have to ask or learn more about it.
Yes, that does sound nice. Thank you both so much again for talking with us today about this. And Charlie, I'm glad you're doing well.
Thanks.
Thank you.
Of course. You are so welcome. And everyone at home, if you would like to see this interview again, just head to First Coast News Plus.